Hi friends, in this series of respiratory system examination, today I will talk about cough. First is the disclaimer. Caring Docs YouTube channel does not provide medical advice. Information available on this channel does not offer diagnosis or advice regarding the treatment. Information provided by this channel is for educational purpose only. It should not be used as an alternative to healthcare professionals' diagnosis or treatment of any person or animal. Please seek the help of medical expert for diagnosis, prevention, and treatment of medical illnesses. There is no endorsement for any brand or a company. As we know that cardinal symptoms of respiratory systems are cough, cough with expectoration, hemoptysis, dyspnea, chest pain, and various other. In this video, I will be talking about cough. Cough, it is a sudden and variable expiratory thrust of air from the lungs through the air passage associated with phonation, which momentarily interrupts the physiological pattern of breathing. Mechanism is cough reflex is initiated by a chemical or mechanical stimuli, and this is carried by Afferents, which are type C and type 1 fibers, and innervate the pharynx, larynx, large airways, bronchiole, and lung parenchyma. The afferent travels via vagus and superior laryngeal nerve. Nucleus tractus solitarius in the brainstem is the cough center. Efferent travel by vagus, phrenic spinal motor nerves to the larynx, trachea, bronchi, diaphragm, and hence produces cough. The mechanical events during the cough production are: first is the rapid succession of a fairly deep initial inspiration, the tight closure of glottis, reinforced by the supraglottic structures, the quick and forceful contraction of the expiratory muscle, sudden opening of the glottis while the contraction of the expiratory muscle continues. Cough is classified based on the etiology as respiratory causes and non-respiratory causes based on the duration of the cough. If the duration of the cough is less than 3 weeks, it is considered as acute cough. 3 to 8 weeks is considered as subacute cough, and when it is more than 8 weeks, it is considered as a chronic cough. And based on the expectoration, it is either productive cough or dry cough depending on the presence or absence of expectoration. When the patient presents to us with chronic cough, he may have normal chest x-ray also, and this is very common in cough variant asthma, tropical eosinophilia, upper airway cough syndrome, aspiration, habitual cough, foreign body, drugs like angiotensin converting enzymes inhibitors, chronic bronchitis, and chronic idiopathic cough. This is the cough reflex arc. Here we see the receptors. Cough receptors are located in larynx, suprapharyngeal areas, tracheobronchial tree, artery canal and tympanic membrane, pleura, pericardium, and diaphragm, esophagus and esophagus and stomach. The vehicles from these impulses travel as afferent and carries impulses to the CNS in the cough center that is situated in the medulla or the midbrain, that is the nucleus tractus solitarius, and then the efferent from the nucleus tractus solitarius come come out as a vagus nerve or then phrenic and spinal motor neuron from the to the effector organ like trachea, larynx, bronchi, diaphragm, and expiratory muscles. So up to 2.5 liters of air are rapidly inspired. When then epiglottis closes, vocal cords shut tightly to entrap the air within the lungs, and abdominal muscle and the internal intercostal muscle, they contract for forceful expiration. Then there is a rise in pressure in the lungs up to 100 mm of mercury or more. The vocal cords and the epiglottis then suddenly open widely and air explodes outward. It may be 75 to 100 miles per hour speed under high pressure in the lungs, and rapidly moving air carries with it the foreign matter present in the bronchi or the trachea. The classification of the cough based on its etiology, as we discussed: acute cough when it is less than 3 weeks, subacute cough when it is 3 to 8 weeks, chronic cough which is more than 8 weeks duration. The causes of acute cough, the respiratory causes are tracheobronchitis, bronchopneumonia, viral pneumonia, acute and chronic bronchitis, pulmonary embolism, and the sudden onset cough in acute cough can be bronchial asthma, asthmatic bronchitis, whooping cough, or foreign body. The non-respiratory causes of acute cough are left ventricular failure, gastroesophageal reflux disease. The respiratory causes of subacute cough are tuberculosis, pneumonia like bacterial, viral, or fungal pertussis, bronchiectasis, post-viral tussive syndrome. And the non-respiratory causes of subacute cough are GARD, Tourette syndrome, and intentional cough. The chronic cough which lasts more than 8 weeks, the respiratory causes are COPD, asthma, interstitial lung disease, tuberculosis, cancer, pneumoconiosis, mesothelioma of the lung, upper airway cough syndrome. And the non-respiratory causes of chronic cough are drug-induced like ACE inhibitors, beta blocker, non-steroidal and non-steroidal anti-inflammatory drugs, habit cough syndrome. The various terminologies are used for different types of cough. Like dry cough, it is seen in pleural disorders, diseases of the interstitium, mediastinal lesions. Productive cough is seen as a suppurative lung disease, airway diseases. Brassy or Gander Brassy or Gander cough is metallic sound due to compression of the trachea by intrathoracic space occupied lesion or aortic aneurysm, also known as leopard growl. Leopard growl. Bovine cough, it is a loss of expulsive nature, as in a tumor pressing the recurrent laryngeal nerve. Paroxysmal cough is seen in whooping cough, chronic bronchitis, foreign body, and bronchial asthma. Barking cough, when there is involvement of the epiglottis. Croup is the term used for barking cough. It is because of laryngotracheobronchitis, and barking cough can be seen in hysteria also. Spluttering cough is because of tracheoesophageal fistula, cough while swallowing. Hacking cough, when the patient have heavy smoker, patients with chronic pharyngitis or laryngitis can have hacking cough. Autogenic cough is due to stimulation of Arnold's nerve in the external auditory meatus because of impacted wax or foreign body. The causes of chronic cough can be summarized as respiratory causes like viral bacterial infection, bronchospasm, COPD, non-asthmatic eosinophilic asthma, bronchiolitis, malignancy, parenchymal disease such as ILD, bronchiectasis, cystic fibrosis, sarcoidosis, pleural disease, aspiration. Upper airway disease can also cause like postnasal drip, sinusitis, inhaled foreign body, tonsillar enlargement, cardiovascular disease like left ventricular failure, mitral stenosis, gastroesophageal diseases, neurological disease like aspiration, drug and irritants like ACE inhibitors, cigarette smoke. These are all causes of chronic cough. Important question in the history of chronic cough, which we should always ask to the patient is: have you had a recent cold, sore throat, or viral infection? Do you have a history of asthma, nocturnal cough, or wheeze? Do you experience nasal discharge or sinusitis? Do you suffer from acid reflux, indigestion, or coughing after meal? What time of day is the cough worse? Do you smoke? Are you breathless? Have you coughed up blood? Do you have a hoarse voice? Have you had fever or night sweat? Have you lost weight? Are you getting chest pain while coughing? A good doctor's comforting and reasoning words are sometimes more powerful than medicine. With this, I conclude my today's topic on cough. Next video, I will come with another cardinal symptom of the respiratory system. Thank you. Keep learning.